Hello. Today we continue our classes. Today is a plantar fasciitis. How many of therapists get these cases in the past? Like people come in and they describe this sharp pain in the heel, especially when they wake up in the morning, the first couple steps. It's a painful, it's really hard to step on the foot, and during the day it's going away. And people don't know, people confused. They might think it's like inflammation. It's actually inflammation. So what I'm do first time, I'm do assessment of the foot and see how the foot look like. Sometimes actually the girls who's wearing the high heels, it's create the high arch. It's create this really tense plantar fascia and create also discomfort and pain. And I'm asking the question, are you wearing the heels? And they said yes. And I say, just stop wearing the heels and it's gonna go away. And they say never. I say, all right, so you're gonna experience your pain forever then. You're gonna be suffer all your life. So that's how girls sacrifice, live in pain, but try to be beautiful or try to be attract someone. Most of the time, the doctor is gonna tell you, take inflammatory pills. They're going to tell you do some ice, rest. They put some in usually in those braces. From my case, it's not going to help a lot. I see people doing all that stuff. I said, and it's taken to the next level, which is they have to do cortisol shot, injection shot, or even surgery. The thing is, check this ankle and hip also. Let me check for the camera on the purpose this one. But the idea is bring to 90 and check this ankle. Have to be 20 degrees. It's nothing up there. This one is great. So you can see I check eversion. Yeah, that's a little bit limited also. Now I'm checking the hip. I have to check the hip. Hip, internal rotation of the hip 35 degrees, great. External rotation 40, 45, she's good. So nothing in the hip. It's a lot of stuff in the ankle. We're going to work an ankle and treat it as a plantar fascia, but she don't have a plantar fascia. Or we're going to treat the ankle mobility. Let me check this one because I'm going to treat for the camera that one. This one is actually kind of okay. This one is worse. And also what I'm looking for, how she's laid down. Is that like a spreading legs on the side or it's a straight? What kind of position of the foot? Is that the plantar flexion or is it dorsiflexion? I'm always pay attention. You see, she kind of this in plantar fascia, plantar flexion right here. Okay. I can also check the hips, level of the hip. Hip is great. Everything is level. Yeah, this is what I'm doing. You can add your own stuff. Yeah. But yes, you feel that hamstring and you start pulling towards you, get this counterforce and you feel more. You can ask her to do that, but some clients want to be relaxed and they
I can feel
frustrated with this pain. Yeah, that's what I'm saying. Issue tuberosity. You get this issue tuberosity, lock it in, lock it down like this. The palm is going, the fingers go towards me. The palm is coming right on this issue tuberosity, and this is what I'm doing. I pull. Let me show. Yeah, you can definitely see it on this camera. Perfect. Yeah, on the top. Yeah, you can.
You don't use oil.
I don't use oil, but you need the oil?
Yeah, let me have a little.
Okay, let me get you some oil. Yeah, so those
I don't use too much.
oil people, here we go. Yeah.
That's good.
I don't use too much, and you come in, it's like a gallon of oil around the bed. Yeah, I tell you. I saw that once. I went to the house calls, and was the latter was massage therapist up there from other company, and some girl, I don't know, she's like a pouring oil on people. And yes, start sliding this. This is tuning fork. Start sliding down and a little bit rotate. Like pumping. Use your body weight. Let me show you. So you see what I'm doing? I'm kind of slide down. This one is already smooth and nice, and it's a lot of oil, of course. Let me give you more oil. Here we go. So, but it's working. It's working well. On the top. There we go. See? I can lean actually, and I can just work this way. Watch. It's already in the stretch. Yeah, you just put, and you can move all around. You see, she's in the front and the flexion, and this is extend, so you can truly work all those fascia bags. She's gonna run like a baby today. Next one. You still do the same. You hold this position, but now you rotate and watch just like this. Not you going this arm going outside, so towards the midline. Yeah, perfect, just like that. See? So this is moving, and you go. Perfect. Let me see it. Yeah, you're doing great. So this is the catchy motion. This is catchy motion, but you guys going to pick it up. Sorry, it's not hard. Okay, perfect. Pump again, pump with your body weight. Excellent. Perfect. And let's do perfect. Let's do mobility now. You're doing good. Next one, you, like this. Lift it up. You can shake it up a little bit. And now you start moving with your, I want to work on this area. Make sure this is the smooth motion up here. What I'm doing here, I found that space between the tibia and the talus right in here. And what I'm doing here, I'm just apply 2 fingers and little pressure towards, how's it feel? It feel good. So here we go, more space. I'm leaning. I can do with one thumb, but it's going to be, so I'm attached, grab the heel, place this on my forearm, just like that.
Too much pressure?
Yeah, that part.
Sensitive. So yeah, if this is sensitive, that's okay. Go a little bit gently and kind of move that foot in. Yeah, Yana, she's really great therapist. You guys can book her if you're a runner. Look at this. She can mobilize your foot. And this is what we're doing here. Perfect. Excellent. Now go ahead, open up. Yeah. Here we go. Look at that. Beauty. That's all right. That's all right. Put on the top. Here we go. Grab it. Here we go. Look at that. This is going to be great mobility. Ooh, look at that. Does anyone massage therapist guys do it to you like this? No one, because we do. So watch. This is how you do it. You kind of like push. Yeah, and you pick it up. You see, you push and you pick it up. And pick it up. You pull and you pick it up. So this is create that arc. Yeah, so you see what I'm doing? And or you can do this way. You like roll it, spread around and do a couple times. Try to do it here. Roll. Here we go. Really good. Really good. Next one, you can guys use the half foam roller, or it's all right. I can attach it again, and here we go. You see that? How's it feel? It feels great. So this is probably about the homework. If you want to step and roll on the foam roller, I highly suggest start with something bigger, like a water bottle or like shaker, and roll on that. Don't get this lacrosse ball because it's going to be painful for you guys. Yeah, and decrease the radius of the roller. So start with get the PVC pipe in the Home Depot, like that big size, and get smaller, smaller, and smaller. Don't start with a small PVC pipe. So probably like, I don't know, 5 inches, not the 5 inches, like maybe 4 or 5 inches. And roll it. Step on it, roll it close to the wall, and see how they go. All right? Thanks for watching, and good luck with your plantar fasciitis. Treat it quick, because if not, it's going to create more problem, and you don't want to get surgery. You have a good day. We'll see you next Tuesday. Bye-bye.